Tuberculosis, or TB, is a serious global health issue, affecting around 1.2 million children per year, of whom nearly 1 in 5 will die. Children mainly die from TB because they have not been diagnosed for the disease in time, and so they have not been treated for TB. A recent diagnostic tool called Treatment Decision Algorithms, or TDAs, has been developed to help healthcare workers to make diagnostic decisions related to TB in children. TDAs have been recommended by the World Health Organization for TB diagnosis in children, but the recommendation needs to be strengthened with more data in what is called external validation. Decide TB is a collaborative project between Ministries of Health and research institutions in Mozambique and Zambia, supported by research institutions in Europe and South Africa, aiming to provide data to do the external validation required by the WHO. Decide TB will implement and evaluate TDAs in routine conditions at lower levels of healthcare in Mozambique and Zambia. National TB programs in both countries will deploy TDAs in health facilities in 5 pilot health districts, including the district hospital and 6 primary health centers in each district. Practically, healthcare workers will be trained by trainers from the National TB program on how to use TDAs and how to read chest X-rays. They will receive tablets to help them collect medical data for children and calculate scores. They will be supported through regular support supervision and clinical mentoring visits in the use of these new diagnostic tools. In each country, districts will progressively start using the TDAs with the support of the national TB programs in a random order determined by the researchers within what they call a stepped wedge randomized trial. With the Decide TB trial, the Instituto Nacional de Saúde in Mozambique and the University of Zambia in Zambia will collect data with the support of other African and European researchers to evaluate how well TDAs work. If healthcare workers like TDAs, if they manage to use them, how much it will cost to use TDAs, and of course whether TDAs increase or not the diagnosis of TB among children, especially the vulnerable ones. Through this close partnership between researchers, implementers, and decision makers, the Decide TB project results will be rapidly integrated into routine clinical practices and national and international policies. The Decide TB project aims to make a big step in fighting childhood tuberculosis. It uses new diagnostic tools and thorough methods to make sure no child is left untreated.